Over 6 million Americans are living with heart failure right now, and most of them had warning signs they ignored. What if those little things you call aging, like breathlessness, swelling, or fatigue, were actually your heart crying for help? Ignoring these 13 early symptoms of heart failure could cost you years of life, but recognizing them early could save it. Have you ever felt more tired than usual, or found yourself waking up at night struggling to breathe, and thought it was just part of getting older? The truth is, your body may already be sending you silent warnings of heart failure. These signals often appear months before a major health crisis, yet many people mistake them for stress or age. Today, I'll walk you through 13 early signs of heart failure, subtle but life-saving clues that can protect your health, your independence, and even your life. If you're over 60 or care for someone who is, you cannot afford to miss this. Before we get into the warning signs, let's take a moment to understand how a healthy heart works. Your heart is not just a muscle, it's the body's lifeline. With every beat, it pumps oxygen-rich blood through thousands of miles of blood vessels, reaching every cell from your brain down to your toes. In a single day, it beats about 100,000 times, moving nearly 2,000 gallons of blood. When it's strong, this process feels effortless. You climb stairs, garden, or walk with your grandchildren without noticing your heart at work. But when it begins to weaken, blood flow slows, fluid builds up, and your organs don't get the oxygen they need. The danger is that your body rarely shouts, it whispers through subtle changes that are easy to dismiss. And that's why recognizing these early whispers is so important. 1. Subtle, early changes: fatigue and reduced stamina. Do you remember a time when grocery shopping, tending your garden, or walking around the block left you feeling energized? For many of us, those daily activities were never a struggle. But when you start to notice that these same simple tasks leave you drained, it may not just be age catching up with you. A healthy heart supplies your muscles with a steady flow of oxygen-rich blood. That oxygen is what fuels your energy, your movement, and even your mood. But when the heart weakens and cannot pump effectively, your body begins to ration energy. Blood flow is prioritized to your brain and vital organs, and your muscles are left running on less. The result is a deep, persistent fatigue, one that does not disappear after a nap or a good night's sleep. This is why so many people with early heart failure describe their tiredness as different. It feels heavier, more constant, and it lingers no matter how much rest they get. They may start avoiding activities they once loved, making excuses for why they no longer join friends for a walk, or quietly sitting out tasks at home. Sadly, many dismiss it as just getting older. But real aging happens slowly. When your energy fades rapidly, it can be your heart trying to send you an urgent message. Shortness of breath. During activity, have you found yourself pausing halfway up a flight of stairs, or stopping to catch your breath after only a short walk to the mailbox? If this is new for you in recent months, don't ignore it. Breathlessness with activity is often one of the earliest red flags of heart failure. Here's why. When your heart cannot keep up with your muscles' demand for oxygen, your lungs try to compensate. They work harder, pulling in more air, but it still feels like you can't quite get enough. This is not the same as being out of shape after years without exercise. That kind of breathlessness improves as you train your body, but the shortness of breath caused by heart failure tends to get worse over time, even with activities you used to manage easily. What makes this symptom particularly dangerous is how easy it is to explain away. Many seniors think, of course I'm slower than before, I'm not 40 anymore. But the truth is, if you notice a sudden change needing to stop and rest where you never did before, it could mean your heart is struggling. Medical studies show this sign often appears months before more dramatic symptoms, giving you a critical window to act before the condition worsens. Shortness of breath. When bending, bendopnea. Now here's a symptom that many people have never even heard of yet. It can be one of the most telling. Have you ever bent forward to tie your shoes, to pick up something from the floor, or even to lean over a sink, and within seconds felt like you couldn't breathe? This is called bendopnea. In healthy people, bending forward might make you feel a little pressure in the stomach, but it doesn't usually affect your breathing. In someone with heart failure, though, bending increases the pressure inside the chest and abdomen. For a heart that is already struggling with elevated pressures, this small movement can be enough to trigger shortness of breath almost instantly. What makes bendopnea so important is its specificity. Research has shown that it is strongly linked with advanced heart disease. In fact, doctors sometimes use it as a simple, non-invasive clue to hidden heart trouble. If you experience shortness of breath within 30 seconds of bending, it is not something to brush off. It is your body revealing that your heart can no longer handle even small increases in stress. And once again, this is not about age. Many healthy people in their 70s and 80s bend over daily without feeling suffocated. If this is happening to you, it deserves attention. These first subtle changes, feeling unusually tired, getting short of breath with activity, or struggling to breathe when bending forward, are often the earliest whispers of heart failure. The tragedy is that so many people wave them away, blaming stress, aging, or simply being out of shape. But these are not signs to ignore. They are the body's cry for help, appearing long before a crisis. And this is only the beginning. As heart failure progresses, the signs become harder to ignore, especially at night. Let's now look at the next group of warning signals, the changes that disturb your sleep and your breathing after dark. 2. Nighttime and breathing symptoms, difficulty, breathing. When lying down, orthopnea. Have you ever noticed that lying flat on your back makes it harder to breathe? At first, you may add an extra pillow just for comfort. Over time, one pillow becomes 2, then 3. Some people even find themselves sleeping upright in a chair because it's the only way they can rest without gasping for air. This condition is called orthopnea, and it is one of the clearest signs that the heart is struggling. When you lie flat, gravity no longer helps return blood from your legs and lower body to your heart. For a weakened heart, that extra volume becomes too much, and fluid starts to back up into the lungs. That backup fluid makes each breath feel labored, like your lungs are too heavy to expand fully. The sad truth is that many people dismiss this as simply a matter of preference or habit. But if your sleeping position has changed drastically, if you need more pillows or must sleep upright, it could be your body's way of shouting that your heart can't keep up. Sudden breathlessness at night, paroxysmal nocturnal dyspnea. Now imagine this. You're asleep, resting peacefully, when suddenly you jolt awake, gasping for air as though you're drowning. Your heart is racing, your chest feels tight, and you have to sit up or even stand by an open window just to catch your breath. This frightening experience has a medical name, paroxysmal nocturnal dyspnea. It happens because during the day, fluid often pools in your legs and lower body. When you lie down at night, that fluid redistributes and flows back into circulation. A weakened heart cannot handle the sudden volume, and the lungs quickly fill with fluid, triggering severe shortness of breath. Many people mistake these episodes for nightmares, panic attacks, or even sleep apnea. But the specific pattern, waking 2 to 4 hours after falling asleep, gasping for air, is a classic sign of heart failure. Patients often describe it as one of the most terrifying experiences they've ever had. And unfortunately, it rarely happens just once. These episodes tend to recur, and each one is a warning that should never be ignored. Nighttime cough or wheeze. Another subtle but important sign is a nagging cough that seems to appear mostly at night or when lying down. Unlike the cough from a cold or allergy, this cough is usually dry, persistent, and disruptive to sleep. Some people describe a slight wheeze, almost like a soft whistling sound when they breathe. Why does this happen? The same fluid that causes orthopnea can also irritate your airways as you lie flat, prompting your body to cough as if trying to clear an obstruction. In more advanced cases, the cough may bring up frothy mucus, sometimes tinged with pink, a clear signal that fluid is leaking into the lungs. The danger here is how easily this cough can be dismissed. People assume it's seasonal allergies, post-nasal drip, or even the room being too dry at night. But if the cough is persistent, worse when lying down, and improves when you sit up, it may be more than just a minor irritation. It may be your heart struggling to keep your lungs clear. Frequent nighttime urination, nocturia. Finally, there is a symptom that surprises many: frequent trips to the bathroom at night. Waking up once is normal for many older adults, but when it becomes 3 or 4 times every night, and each time you produce a large volume of urine, this pattern can actually point to heart failure. Here's why. During the day, fluid often collects in your lower legs and ankles, especially if your heart is not pumping well. When you lie down at night, gravity allows that fluid to re-enter circulation. Suddenly, your kidneys are flooded with extra fluid, and they work overtime to eliminate it. The result is frequent nighttime urination, long before other symptoms may appear. While many blame aging prostates, menopause, or simply drinking too much before bed, nocturia that comes with large amounts of urine is a hidden clue that the heart may not be working efficiently. Taken together, these nighttime symptoms, difficulty lying flat, waking up breathless, coughing when you try to sleep, or endless trips to the bathroom may seem unrelated. But they all share the same root cause: a heart that is no longer keeping up with the body's demands. And while these signs often appear in the quiet of the night, they should be loud alarms for anyone who experiences them. Recognizing them early can prevent hospital visits and even save lives. Next, we will look at the changes you can see and measure during the day: visible swelling, sudden weight gain, and digestive discomfort. These are the outward signs that your heart's silent struggle is becoming harder to hide. 3 signs of fluid retention and poor circulation: swelling in the ankles and legs. Have you noticed that by evening your shoes feel tighter, or your socks leave deep marks around your ankles? This isn't always just from sitting too long. Persistent swelling in the feet, ankles, or legs, what doctors call peripheral edema, can be one of the earliest outward signs of heart failure. When the heart can't pump blood efficiently, circulation slows. Blood begins to pool in the lower parts of the body, and the kidneys respond by holding on to extra salt and water. This extra fluid leaks into the surrounding tissues, causing swelling that gets worse as the day goes on. One important detail: heart-related swelling is usually symmetrical, affecting both legs equally. If you press on the swollen area with a finger, it often leaves an indentation that lasts for several seconds. According to research published in leading cardiology journals, nearly 70% of patients with heart failure show swelling in their legs at the time of diagnosis. The tragedy is that many people dismiss this as simple aging or poor circulation. But when swelling is persistent, worse at night, and leaves lasting marks, it is your body's way of warning that your heart is not keeping up. Rapid weight gain from fluid retention. Another red flag is a sudden increase in body weight over just a few days. If you gain 2 or 3 pounds overnight, or 5 pounds within a single week, it is unlikely to be from food alone. Instead, this is often excess fluid building up inside your body. Why does this happen? A failing heart triggers hormonal changes that tell the kidneys to conserve salt and water. Each pound you gain may represent nearly half a liter of fluid retained. That fluid has to go somewhere into your tissues, your abdomen, even your lungs. Doctors often recommend that patients at risk of heart failure weigh themselves daily because the scale can reveal trouble before more obvious symptoms appear. The American Heart Association notes that sudden, unexplained weight gain is one of the most reliable early warnings of worsening heart failure. This kind of weight change is very different from normal fluctuations. It doesn't come and go. It moves steadily upward, and it often comes with a feeling of bloating or heaviness. If you've been watching your diet but still see the numbers climb quickly, it's a sign that your body is holding on to fluid, not calories. Abdominal bloating, loss of appetite, and early fullness. Now let's talk about a symptom that surprises many people because it seems unrelated to the heart: digestive problems. Have you ever sat down to a meal, eaten just a few bites, and felt uncomfortably full? Or noticed constant bloating and nausea that doesn't go away with simple remedies? This can happen because when the heart fails to pump effectively, blood flow to the digestive organs decreases. Meanwhile, pressure builds in the veins that carry blood back to the heart, causing fluid to leak into the abdomen. This buildup, known as ascites, can make the belly feel swollen and heavy. At the same time, the liver can become congested with blood, leading to discomfort in the upper right side of the abdomen. Patients often describe a dull, pressing sensation rather than sharp pain. Research shows that gastrointestinal symptoms like these are frequently overlooked in heart failure, even though they may appear early in the disease. Doctors from the Cleveland Clinic report that many patients with heart failure lose interest in food not because they don't enjoy it, but because their stomachs physically cannot handle normal portions. This loss of appetite can lead to unintentional weight loss in some areas of the body, even while fluid is causing overall weight gain. It's a confusing picture, but one that makes sense when you realize the root cause is the heart. Swelling in your legs, sudden weight gain, and unexplained digestive troubles may not seem connected at first, but they share the same root problem: fluid building up where it doesn't belong because the heart is not pumping strongly enough. The good news is that these are visible, measurable clues. They can be tracked, monitored, and addressed before they spiral into a crisis. Paying attention to them could be the difference between catching heart failure early and facing an emergency. Next, we'll turn to the final group of warning signs, those involving the rhythm of your heartbeat, your balance, and your circulation signals that come not from what you see, but from what you feel deep inside your body. 4. Heart and nervous system. Signals: palpitations and irregular heartbeat. Have you ever felt your heart fluttering in your chest, pounding as if it's racing, or skipping beats like it suddenly lost its rhythm? Some describe it as if their heart is doing somersaults inside them. These unsettling sensations are called palpitations, and while they can be harmless in some people, in the context of heart failure they carry an important warning. When the heart muscle weakens, it must work harder to pump blood. This stress often leads to irregular rhythms, known as arrhythmias. One of the most common is atrial fibrillation, where the upper chambers of the heart beat chaotically instead of in steady rhythm. According to studies from the American College of Cardiology, atrial fibrillation is present in up to 1/3 of patients with heart failure and is both a cause and a consequence of the disease. These irregular rhythms disrupt the normal flow of blood, reducing the amount pumped with each beat. That's why people often feel their hearts racing even at rest, or experience sudden, uncomfortable pauses. Sometimes, palpitations are accompanied by anxiety or a sense of unease, which only adds to the distress. It is important to note that not every flutter is heart failure. Caffeine, stress, or even dehydration can cause palpitations. But when they occur alongside other symptoms like fatigue, swelling, or shortness of breath, they should never be ignored. They are your heart's way of telling you that it is struggling to keep pace. Dizziness and near-fainting episodes. Another early warning sign often overlooked is dizziness. Have you ever stood up quickly and felt the room spin, or taken a short walk only to feel lightheaded as though you might collapse? In a healthy person, the heart and blood vessels adjust instantly when you change position. The heart beats slightly faster, blood vessels tighten, and blood pressure is maintained so your brain receives a steady supply of oxygen. But in someone with heart failure, these adjustments don't happen as effectively. The weakened heart cannot push out enough blood, and circulation to the brain drops suddenly. The result is dizziness, blurred vision, or even fainting spells. Clinical research shows that fainting episodes, known as syncope, occur in nearly 20% of patients with heart failure. These episodes are not only frightening, but also dangerous, especially for older adults who risk serious injury from falls. Many people attribute dizziness to inner ear problems, medication side effects, or dehydration. And while these can certainly be causes, it's the connection to heart health that makes this symptom especially important. If you find that lightheadedness or near fainting is becoming more frequent, particularly when combined with other warning signs, it's critical to get evaluated. This could be your heart struggling to deliver the blood flow your brain depends on. Cold hands, feet, and weak pulse. Sometimes the signals of heart failure are not inside the chest, but in the tips of your fingers and toes. Have you noticed your hands and feet are often cold, even in warm weather? Or that your fingernails take on a bluish tinge? These are signs of reduced circulation. When the heart cannot pump effectively, the body makes a choice. It prioritizes blood flow to the brain and the heart itself, vital organs that must stay alive. The price of this survival mechanism is that blood flow to less critical areas, like your hands and feet, is reduced. That's why they feel cold, weak, or slow to warm up. Doctors often measure something called pulse pressure, the difference between the top and bottom numbers of your blood pressure. Normally, this difference should be around 40 millimeters of mercury or more. But in heart failure, pulse pressure often narrows, signaling that the heart is not generating enough force with each beat. Studies have shown that a narrow pulse pressure is associated with worse outcomes in patients with advanced heart disease. So if you find your extremities are persistently cold, or your pulse feels weak and thready, don't dismiss it as poor circulation or simply aging. It may be your heart telling you that it cannot push blood through the body the way it once did. Palpitations, dizziness, fainting spells, and cold hands or feet may not seem as obvious as swelling in the legs or trouble breathing at night. But these are signals from your body's most critical system, your heart and nervous system, warning that something is not right. And here is the most important truth. Heart failure rarely announces itself with one dramatic symptom. Instead, it whispers through many small changes, building over time. When several of these signs appear together, they form a picture that should never be ignored. Catching these signs early can mean more years of independence, more time with your loved ones, and a better quality of life. The question is, will you listen to your heart before it's too late? These warning signs don't usually come all at once. They creep in slowly: fatigue, poor sleep, swelling, or a racing heartbeat. So many people mistake them for normal aging. But when several appear together, it is a pattern you cannot ignore. Heart failure often begins with these quiet whispers from the body, not a sudden emergency. The good news is that if it's detected early, it can be managed. With proper care, medication, and healthy choices, many people live longer, fuller lives. Early action prevents complications and gives you more time with the people you love. So if you've noticed these symptoms in yourself or in someone close to you, don't delay. Speak with a doctor and get checked. Your health is far too valuable to take for granted. If this video was helpful, please share it. What may seem like a small act could give someone the knowledge they need at the right moment. Sometimes, sharing truly saves lives. Take care of your heart, listen to its signals, and remember, you are never too old to take control of your health. Thank you for watching, and don't forget to subscribe for more life-saving health content.